Welcome to your number one breakfast show on radio in the east of the Niger, Hard Talk, reaching from Spin 95.3 FM, Omahia. Today is Thursday, the 23rd day of April, 2026. Chukwuemeka Igu is my name, your regular host on the show. And in case you just tuned in, this program is streaming live on YouTube and other social media platforms. For Facebook, Spin 95.3 FM, and YouTube, alphaspintv. Alpha is ALPHA. SPINTV, alphaspintv. It's streaming live there. You can go there and view it. Subscribe to our channel, leave your comment, and send your thoughts to our WhatsApp if you choose that platform. 0805 5516 953 0805 5516 953. And this morning with me in the studio is the Honorable Commissioner for Poverty Alleviation and Social Protection in Abia State, Honorable Mrs. Ngozi Felix. Good morning, Honorable Commissioner.
Good morning, Chukwuemeka. Thank you for having me.
You're welcome to Hard Talk.
Thank you.
All right, this morning we are going to look at the EU UNICEF sponsored social protection program, how it is happening in Abia State. Let me just give you a preamble for the program. Now, this program was launched on September 24, 2025 in Omahia, and the partners include the Abia State Government, European Union, UNICEF, International Labour Organization. From the budget, 13 million euros was budgeted for 4 states, Abia, Benue, Oyo, and Sokoto states, and it's supposed to run between 2024 to 2027. Now, the program is aimed at building an inclusive, shock-responsive, and sustainable social protection system so that vulnerable families don't fall through the cracks, according to UNICEF rep. Now, it also aims to strengthen the state social register, update, digitize it so that poor and vulnerable households are actually captured and can be reached. So tell us, what is it more about it first? Let's begin with that.
Thank you very much once again for having me. I'm actually very delighted to be here to provide insight into this conversation. We cannot talk about this subject without letting our listeners understand what poverty is. And whatever we are doing, and we're grateful to our partners that have come in to partner with this current administration. Development partners are always looking for solutions to fund. They do not fund problems. They fund solutions. And having seen that in Abia State, we currently have a reform-minded governor, they decided to come in to partner with him, having listened to him, having looked at his blueprint. So it is said that if you don't know where you're coming from, you may not know where you're going to. So I would start by linking this directly to the manifesto of His Excellency. That's where we're working from. We said to Ndiabia, the people of Abia State, concerning looking after the poor and vulnerable, that we will intentionally create policies and programs that will reverse a long history of uncharitable treatment to our retirees because they are vulnerable, our persons with disabilities. We have over 400,000 of them in Abia State according to a UN statistics. We have vulnerable citizens, and we said we're going to ensure that these groups of persons, that their basic needs are met because they are very important to the fabric of society. And we said that to do that, we will enable them to continue to contribute to society and live a life of dignity. So what we are trying to do is to ensure that our people live a life of dignity. So when we say that this government is people-based, that is why His Excellency had to create a ministry, in 2024 to look after these segments of our society that are very critical. Of course, they said the true measure of good governance is how well you look after the most vulnerable of your society. So that's where we're coming from. And we were able to attract that partnership because there is something to work on. There is already a blueprint. There is already a vision, that the partner can connect to, given where the world is today in terms of social protection. So, what is poverty? Some people think that poverty is what it is not. But I would like to let people understand, our listeners understand, what poverty is. And it is actually a very simple definition. It is actually any condition in which an individual or a household or a community is unable to afford essential resources that characterizes a minimum standard of living. And what are these resources? Food, clothing, and shelter. So, simply put, when people are not able to afford food, clothing, and shelter, they are regarded as poor. And we cannot abandon them, because it's very important that we look after them. Otherwise, we will not have a peaceful society. So, this ministry, called the Ministry of Poverty Alleviation and Social Protection, is actually linked on two pillars. And it's here to alleviate poverty. And how do we do it? Complementing with social protection in terms of set policies and programs of government. So government deliberately, remember we said in our social contract to Abia, the vision, we said we're going to intentionally create policies and programs. So social protection has to come in, because social protection focuses on the people. And in focusing on the people, it intentionally creates policies and programs that are targeted at reducing or eliminating adverse effects of social and economic shocks on an individual or a household. And these programs have to be intentionally created. You have rightly put it that in our social register, we have a certain number, of households there. A household, 240. Yes, 240,000, thereabouts. But that is grossly insufficient, given that the National Bureau of Statistics has put the poverty rate of Abia before now, in terms of 2022 data, that we have around 31% of poor people in Abia.
And Abia is ranked number 8 in Nigeria.
Yes, and we have a population of around 5 million, based on the last census. Now, if you look at that, what we have on our social register is grossly insufficient. Does not meet the 31% that we're set to cover. Yeah. We cannot handle poverty or alleviate poverty if we don't have data. Nigeria has been said to be a country that has no data. So if something happens in a place, if there's an emergency, you cannot tell the number of persons that are involved, how many persons were there when this emergency situation happened. So data is very critical to alleviating or reducing poverty. If you do not have data, you cannot also create policies and programs for the people, because this is about planning. And in planning, you must know how many persons you're planning for. If you have 5 million people, then you make plans that will cover the 5 million people. If you have 10 million people and you make plans that cover only 5 million, then you have intentionally excluded 5 million. Yeah. So that is why it's very critical that we have that database. The social register is our state social register. So this program, the EU Support to Sustainable and Innovative Social Protection Systems, has come in to partner with Abia State government to update that register. That register is currently being updated across all communities and local governments. We have over 3,000 communities in Abia State as we speak. And the previous register before now did not cover certain communities. Certain communities were left out. So if you go to the register, you will see that there are certain communities that are missing from the register. But we have now decided that intentionally we will ensure that no one is left behind. If we need to guarantee a life of dignity for all, we must ensure that no one is left behind, and every community has to be covered. And that is the reason why this current updating of the social register is happening in partnership with this program called SUSI. Thank you.
Okay, thank you very much. Now, this social register, apart from capturing communities, now the main target are the households. Now, how do the households get their names into the register? To get communities is easier. You can stay no more and get it. But the households that are the main target, how do they get registered to benefit from this program?
Thank you very much. So currently we have a team called Community-Based Targeting Team. CBTT. They are our people, civil servants working in the Ministry of Budget and Economic Planning. And they go out to the communities. The communities are made up of people. So when we say community, it is human beings that are living there. So they go out to these communities, and there are steps for the capturing to be done. They first of all sensitize the people, about what it is, because nobody will want to give you their personal information if they do not understand what it is. Remember that Nigeria is a very low trust society, so people are really afraid when you ask them for information that are very personal and private to them. So they go out, they carry out a certain sensitization so that people are aware of what this is about. And after the sensitization, of course, the capturing process, begins before we now go to validation. So the reason we needed to update as well is because we have a huge number of attrition in our social register. Some people have moved from one place to another. Some people are no longer alive. So sometimes when we have interventions and we mine data from that register. You could mine, for example, during the time we had the NG Cares 1.0, the cash transfer, conditional cash transfer program last year. You could mine data, and by the time you go into the field to now implement, you find out that some of those persons are no longer there. They have passed on over the years, and we were not aware. And because we're not aware, we have to now go back. Because if we say we want to reach out to, for example, 5,000 poor and vulnerable persons in Umuahia, we do not just select people from the space. We have to work with a database, and we go to that database, mine people who are living, the data of people who are living within that geographic space, and then we now go into the field to implement. When we go into the field to implement, we may have mined 5,000, but we can get into the field for implementation and find out that we can only reach 4,000. And the 1,000 or 500 or other numbers are no longer available because they have passed on. So we will now have to go back to the register because we have a target of 5,000, for example, and we must meet that target. So this update that is going on now will help us to also clean the database. Clean it out. If there are huge numbers of attrition, persons who are no longer there, or persons who have moved from, where they are in terms of being poor and they're now okay, or they're not doing well, or situations have changed, it will help us understand and be able to have a database that is not just expanded, but also properly updated with the right information.
Okay, now this is very, very important. I want to ask, how do you determine who should be registered? Because the idea is the poor and vulnerable persons. Now, when this social register was opened, how do you ensure that the people there are the main target and not political names? You understand what I mean? Not because you work there, then you just register your family members, your friends, and all that so they can benefit. How do you scrutinize that?
Thank you for that question. If we go by what that register is, it is not just a register, or should not just be a register that covers people who are poor and vulnerable. You know why? Okay. You could be above the poverty line today, or something could happen and the person will drop below the poverty line. That register originally, universally, is supposed to contain information about every person that is in Abia, whether you are poor or not. It's not supposed to be a register for only the poor and vulnerable. Okay. Because somebody can become poor and vulnerable at any point in time, and you cannot determine when they will be poor and vulnerable. So, like it works in developed world, you have that information there, and it is being checked and monitored to know where each person is. So it should cover people from when they are born. So if somebody is born, that person's name automatically should get into the register until when they die. So it's a life cycle database that should not exclude anyone. But because of where we are in Nigeria today, we are focusing more on people who are poor and vulnerable. And you have asked a question, a very good question. How do we know who is poor and vulnerable? The poor and vulnerable are people who are Children, of course, are poor and are vulnerable. Vulnerability can be divided into different categories. If somebody is unemployed, they are vulnerable. If somebody is sick, maybe they had an accident, they were working before and they are no longer working, they are vulnerable to shocks, economic shocks. If somebody is chronically ill from maybe a degenerative disease or sickness, they are regarded as vulnerable. People who are aged, the elderly, they are vulnerable because they no longer have the kind of strength that they used to have to work the way they work and provide, economically and financially for themselves. So these persons live within our spaces. Persons with disabilities, like I've said to you, a UN database had put the number of persons with disabilities in Abia State at over 400,000. And if we have a population of 5 million people, then you can already tell what percentage of our population that is. And disability is something that can happen at any point in time. Even old age can lead to disability. Whether the person becomes visually impaired, they lose their sight, or they become hard of hearing, or they become something happens and they're no longer able to walk. They need assistive devices to be able to carry out their daily activities. So these groups of persons are vulnerable. Now, how do we know they are vulnerable? In our localities, they live all around us. They live there. So when capturing is being done, we don't just sit in an office and bring names from everywhere. Like I said, we have a community-based targeting team. They go into the local communities. They go into the hinterlands. They are there as we speak, capturing people. And as people are being captured, they are also being monitored. So it is not that people just go out and come in and there's no process. There's a process through which this capturing is done and validated. We have, though they are our people, we also have support from the National Office, the National Agency for Social Safety Nets Coordinating Office, NASCO. So we have people from your question or the comment you made around the cash transfer where you were captured and you were not paid. If you were captured, it doesn't mean that if you were captured, you will be paid. Okay. Like you said, you went, maybe they saw that you were not a vulnerable person and you were actually wrongly captured into that program. If you were, you met the criteria, the set criteria for being a beneficiary, certainly you will be paid.
Okay,
so
I did meet up.
It perhaps, in your case, I can't tell what may have happened because you have gone there twice and you were not paid. And there is a process of, there's a grievance redress mechanism, a way to actually go back to them to say, I was captured. They should have told you why you were not paid. Did they tell you?
Nope.
Okay, so you need to go back and ask them, why have I not been paid? And at that point, they may now be able to explain to you why you have not been paid. If you have a job and you're gainfully employed, you are not supposed to be captured. You are not.
Well, you said it's meant to capture everybody in Abia.
But I also said that is the register. Okay. The register contains the database of everybody. But police programs target people who are vulnerable now.
Okay.
So vulnerability, I'm listed a certain number of vulnerability areas.
Yes.
If somebody is employed, are you employed? Unemployed? Sorry. If you're unemployed, you're not vulnerable. If you are employed, rather, you have a job at SPINTV, you get a monthly remuneration. We don't regard you as somebody who is vulnerable because you have a job. But people who are unemployed are the persons who perhaps fit in.
What of underpaid persons? Let's say you work somewhere and your take home every month is 20,000 naira. Are you vulnerable or not? We cannot.
Why are you underpaid?
Because that is what your employer can afford, and you can't just stay at home doing nothing.
But you know that at this moment you can't even pay somebody 20,000.
People still get paid with 20,000 in Abia. Why here?
We have a minimum wage. Minimum wage says you cannot pay somebody less than this amount.
It applies to government.
So the government of Abia State does not pay anybody such amount.
I mean the minimum wage. What about the private sector?
Private sector, that rule applies also to the private sector. So if your employer is cheating you, then you need to go back and take it up with your employer.
Is government doing anything to ensure full implementation across board
of the minimum wage?
Yes.
Well, government is looking after what government should look after. Government is not responsible for insisting that a private person must pay. We haven't gotten there yet, where you have to. Government cannot go around and be chasing everybody. What government needs to do is to set an example. So government is the pace setter. Government has set the pace for others to follow, and there are laws guiding these things. There are policies guiding this remuneration and minimum wage things. So people just need to align. And if somebody's not aligned, it's like when they say this is a crime. If something is said to be a crime, then it is a crime. If you see that somebody has committed that crime, you need to escalate to the right appropriate bodies.
Okay, let's not go into that. We have an issue at hand now, because I don't know if my employer is not paying me minimum wage, whether I should take him to court or resign. If I don't like it, I should resign. It's simple as that.
Absolutely, I agree.
But anyway, let's go back to the issue we're discussing.
Yes.
Now, this money, how much came to Abia State out of the 13 million euros?
I'm sorry, I missed that while trying to respond to your issue around cash transfer. The money is not allocated to states in terms of, okay, it is 13 million. And this 13 million, you divide it by 5, because it's not just 4 states. It is 4 states and the FCT, 4 states and the federal. So it is not something you can just say, okay, this money is 13 million, let's do 13 million divided by 5. No, it is not allocated in that way at all. What matters is that there is a work plan, there are a list of activities that need to be covered. There are 4 areas, actually, 4 objective areas that need to be captured in the register, in the program. Number 1 output is to expand the social register, which is happening right now. Number 2 output area is to have improved capacity, so trainings for our staff and policymakers, both at the national and the state level. So policymakers need to be trained. They need to understand what social protection is all about, because this work that relates to social protection has to be done by people. So, for example, if somebody does not have the right information and knowledge, and you tell them to go and capture a vulnerable person, and they capture somebody like you who is working, they have gone against the rules, Or we say, okay, make payments. We are going to design a program. This program is supposed to reach out to elderly persons who are 60 years and above, and somebody who is 40 is captured. It can happen if the team who are doing the capturing are not trained. So capacity building is very important. It's an aspect of this program. Another aspect that the program covers is policy and legal framework. So in Nigeria, when somebody starts something, because government is for 4 or 8 years tenure, when somebody leaves, another person comes, he sets aside whatever his predecessor has started, no matter how good the vision is, and just starts his own. So to ensure sustainability and that continuation, we need to have it backed by a legal framework. And so a law is going to be passed in Abia State for social protection. This law covers our people. This is about our people. So somebody should not come up and just dump that vision and start something else and do something else that does not continue the work. It's a work in progress. It's not something that you can start and say, I'm done with it. So long as we live in this world, we will continue to have economic shocks, natural disasters, conflicts. All of these things are the things that push people below the poverty line and make them vulnerable. Then the last output area is to have an enhanced management information system. Management information system, it is human beings that are populating that information system. We need to have a system that actually speaks to our context, our needs as a people. So that system is supposed to put together, information that is linked to other databases. So one aspect of this is interoperability. For example, if you go to the Ministry of, let's say, Poverty Alleviation today, and you provide your information, you are not supposed to go to Ministry of Health and provide same information. You're not supposed to go to Ministry of Education and provide same information. You are making the poor person suffer. You are adding to their poverty by making them go from place to place to place to place, providing one information many, many times. So there's supposed to be a once-only policy where somebody provides an information to one ministry and it is available in the database of the other ministry. So those databases are supposed to be linked. That is what we call interoperability. So they are connected and we have like a whole of government in what we're doing. Thank you.
Okay. Now, after all these areas of coverage and all that, and you said the money is not to be divided by 5 or by 4. But at least something goes to every state. And that is my question. How much did Abia get after all the standards are met?
So Abia, this money, the European Union procedures is not a procedure where if a program is signed onto, they divide the money and give it to you in your bank account. No, so it's not done. So UNICEF is the implementing agency and ILO. Once we have an activity like we had, last week, and they were here, what they do is they fund that activity directly. They make sure that the number of participants that should be in that meeting are captured. They make sure that they bring the facilitators or the consultants or people who will, train the participants. They make sure that participants are provided with every information and education materials that are required. And if they need to be paid transportation, stipend for transportation. And so they don't give the money directly to the state and say, take. Okay. It's not done that way. So that's why I said it's difficult for you to say this is how much Abia is going to get. Maybe at the end of the program, we can try to capture how much has been spent on Abia State.
All right, thank you very much.
You're welcome.
Yes, this is still Hard Talk reaching from Spin 95.3 FM Omaha. We are streaming live on all social media platforms. For Facebook, Spin 95.3 FM. Instagram, you can go there. Our post is there also. Spin 95.3 FM. And on YouTube, it's alphaspintv. Alphaspintv. So you can view what is happening here live. Drop your comment or send your thoughts to our WhatsApp line on 0805 5516 953. You've been listening to the Honorable Commissioner for Poverty Alleviation and Social Protection in Abia State, Mrs. Ngozi Felix, and we are discussing the UNICEF EU ILO sponsored social protection program in Abia State, the implementation and all the issues surrounding it. All right, Honorable Commissioner. Now, another thing we want to know is concerning this program. Now, the cash transfers, is it the UNICEF that sends them to the beneficiaries or the state?
Okay, so the cash transfer program is under a package, the NGCares program package. The NGCares package is the package that was put together, by the World Bank. The 1.0 has come to an end, and we have actually signed up to the 2.0 that is about to start.
That's the second phase.
The second phase. This package was put together, when we had COVID. So COVID came on board in 2020, and Nigeria was unprepared. So the World Bank had to support, states, in fact, the government of Nigeria, to put together that package as a way to reach out to, vulnerable persons who were locked down for several months and had their means of livelihood cut off. And of course, that the entire world and even Nigeria recorded a lot of, deaths that happened, whether from the illness or from hunger, So that cash transfer program is a program that is supported by NGCares, and this NGCares program is funded, by the World Bank. It's a loan that Nigeria has taken, but our government, His Excellency, does not actually believe that, you take monies and distribute handouts. Giving handouts to people is not a sure way of alleviating poverty. Yes, there are people who definitely need that cash transfer, so you can't rule it out completely. But if you say you are alleviating poverty or reducing poverty, you can't just take money and give people without ensuring that, they have skills. You need to focus on ensuring that people have skills development that can guarantee, self-sufficiency for them. Our people, based on our culture, are not people who would prefer to line up in front of your gate every morning with a plate and say, please give me breakfast. They come in the afternoon and say, give me lunch. They come in the evening and collect dinner and live like that for the rest of their lives. Our traditions and our culture does not allow that. Our people are entrepreneurial. Our people want to work for themselves. So what we have done in this government is to create that environment that supports people to be financially self-reliant, economically self-reliant. If people have power, electricity, they can go to their business places. If they have access roads, they can carry out trade and commerce from community to community, from local government to local government, from state to state. If the place is secure, like the night markets have returned, you have noticed that. So people can trade between a certain period of time until when they are tired, they go home because there's security. And of course, it is said that if there's no security, there's no development. Without security, there can be development. So His Excellency understands that there are indicators that supports poverty alleviation in different sectors. So poverty alleviation is a big umbrella. It's not about just giving somebody food. It's about ensuring that they have, like I said, clothing, they have shelter. Just a few days ago, there was a groundbreaking ceremony that took place, and Abia will have housing unit, 1,200 housing units. Affordable housing actually is an indicator that ensures that poverty is alleviated. So all of these indicators, whether it is roads, security, health, of course, education, agriculture, energy, power, and water, these are indicators that helps us measure. When we say the people living in Abia are this percentage poor, these are the indicators that are being checked.
Okay, so what it means that Abia did not do the cash transfer. They invested the money into other projects that will help businesses thrive.
No, the cash transfer was carried out. It was given to people who are chronically ill, people who are elderly, people who are with disability, so persons with disabilities. Of course, there is it's not an unlimited funding. So
was it strictly to the elderly and PWDs?
It was. So I just listed the category: chronically ill, the aged, persons with disabilities, and persons who are regarded as, people who are vulnerable in that category. Chronically ill, aged, persons with disabilities, are the people who were targeted for that particular program.
And these were verified to fall into that category?
Yes, they were.
How much did each person get?
Well, it depends. Sometimes, these amounts of monies, when they come in, they are not monies that we can just say, okay, we're not sharing money.
No, it's
the government
cash transfer. There should be a certain amount. Okay, if it's not the same amount, maybe if you are chronically ill, you get 10 naira.
So for the 1.0, for the 1.0, the program normally runs for a period of 12 months. So for
every month, each person will get a transfer.
For a period of 12 months, the amount that persons were paid just so that they can procure maybe medication for those who are ill, so they can have something, to feed, was between 10,000 and 20,000.
So in total for the 1.1, how much did Abia State spend on those cash transfers?
We spent roughly over 600 million.
For how many persons? Do you have the data?
The number of persons we spent cash transfer. Well, because I didn't come here to speak about cash transfer, I didn't get the data. But I know that this was around the figure. I don't have exactly what the database, what the data in terms of amount cost that was spent. And like I said, this money is not monies that our government, is bringing for this program. It is a program funded by the World Bank, a World Bank intervention. It is a performance for results intervention, where if you invest a certain amount, from what you get like a multiplication of what you have invested. So that program happened and verified. So there is usually a team from the World Bank that comes to every state to do like an independent verification assessment to confirm whether these persons were actually paid.
Okay.
And whether they actually got the money, the funds. So if they don't get the funds, then that state is categorized as states that did not meet the implementation requirements.
But the second phase now, is it going to the same people or a new set of persons?
The second phase, like I said, you don't just say, okay, these are the persons. You have to mine data.
Are you going to capture those who did not receive in the first phase?
Certainly. Okay. We will not be giving the same people.
Okay.
But what matters is that we give a certain group of persons, the program runs for 12 months. So if you as a person is being supported, you are supported for a period of 12 months. We believe that within that period, we may have been able to make an impact in you in such a way that we move you from where you used to be to where we feel you're supposed to be. We also support with skills, capacity building for and financial literacy training for even the persons that receive this money. So it's not just the money to eat; it's also money to do other things. And there are other supports that come under that program as well.
So that means for the cash transfer, the state was given a certain amount to give to the beneficiaries. How much was the state given for it?
The state
total, and how much was spent?
So that's why I said I don't have that data here, given that I didn't come here to speak about cash transfer.
Okay, now let's go to another thing. The EU gave ICT equipment for the register. So which LGA has it now? And can a citizen walk in to verify if their names are on the register?
Yes, they can. The ICT equipments are not equipments to be distributed to local government areas or to individuals. They are equipments given to the state to support the capturing
of the register
of beneficiaries into the register. So that equipment is with the state. The state uses it, and of course, the community based targeting team members that I spoke about, that I said that they are the people who go into the communities to do the capturing. These are the equipments they use. So it's not equipment for personal use. It's equipment for official use and for this official purpose. Yes.
Now, if I want to find out if my name is there, how do I do that? Where can I go and verify it? Not necessarily using that particular one given by EU. For instance, we have computers in this office. So can I stay here and verify? How do I do that?
Nigeria, we haven't come to that point yet where the document is made available, to the public.
Okay, it's not online yet.
Yes, it's not yet online. Now, given that this is still controlled at the federal level, states are only giving, maybe the persons that are responsible for managing or manning that particular database, one or two persons in a state are given access. So if you go to the Ministry of Budget, there is a coordinating, a state officer coordinating that particular unit. You can actually say, please, I want to check, is my name on the register, on the social register? But for now, we haven't gotten to the place where the database is available to the public. And really, that is what it should be. What it should be is that you should be able to check, whether your information is captured. But I believe we will come there.
One of the aims of this program is to digitize this program. So is there anything going on to make it digital so people can verify? Because I know the government of Abia State, led by Dr. Alex Otti, is very interested in digitizing governance.
Absolutely.
Is there anything going on in this regard to digitize this particular program?
Yes. Something is going on, and like I said, it's a collaborative effort. The state government has a vision, and that vision is being supported by development partners. And one of the objective areas or output areas of this program is to have an enhanced social protection management information system that is fully interoperable amongst MDAs. So our governor, like you have rightly said, His Excellency Dr. Alex Chioma Otti, OFR, is a man who is sold out to digital process. This is where the world is today. Papers, people are no longer dealing with working on paper. Everything has to be online for also the security of the information that is there and proper management and analysis. So we have the Chief Information Officer who is leading that digitalization process across the state, working collaboratively with every MDA as well as the Ministry of Poverty Alleviation and Social Protection. So that process is ongoing. Like I said, it's a process that is ongoing. It is not a one-off. You can't say within 1 month period or 2 months, we have been able to fully digitalize Abia's information, but it's ongoing. And that's why we have a team currently in our local communities capturing people, who are vulnerable and who need to be in our social register into the register for social protection programs.
All right, quickly, can you tell us one or two things this program has done, the phase 1 of the cash payments, what it has achieved, and then if this one, sponsored by UNICEF, EU, ILO, stops in 2027, will Abia continue with it, also stop it?
Social protection is not only about cash transfer. It's also about skills development. It's also about ensuring that we have our children, receive education. And His Excellency has invested heavily in this area. Of course, you know that Abia children from early years to junior secondary are going to school for free. And it's a lot of children covered. So that's also social protection. It's also about health care, health coverage for our people, universal health coverage. And again, this government has invested heavily. We have the primary health care centers across, the states being functionalized as we speak. Most of them are already up and running so that people are able to access primary healthcare services at that level without having to run to Umuahia or go to a secondary healthcare. That is also social protection. So when you are talking about cash transfer, it's not all about cash transfer. Cash transfer is not, you can give somebody money to eat and they have health needs. You have to also look after them. They are not educated. And if somebody is not educated and they lack information to fend for themselves, to move forward, to grow and develop them personally, their personal development, they are also still poor. So that's why I said it is not handout.
Okay.
It goes beyond that. Okay. Your second question was
the continuity. If
yes,
this one ends in 2027,
it will continue so long as we live in a world where there are emergencies. We must plan and prepare for those emergencies. We must plan to take care of people when there are sudden things that happen to them. We cannot abandon them. And that is why there will be a legal framework.
Yes, on that.
A legal framework guarantees sustainability, continuity. So it's like our state development plan. It had to be backed up by law, knowing that it will run for a 25-year period. We will not be here in the next 25 years. So whoever that continues will not be able to just set it aside, given that this is backed up by law and you just have to continue to work on the plan.
Is the bill already with the House of Assembly or is somebody still drafting them?
No, it's in process as we speak. It's in process. But there is a policy that is also at the stage of being validated. All relevant social protection implementing, stakeholders were drawn from different, places in Abia State, MDAs, so that they could put together that policy. That policy had to be, we kickstarted the process in 2023, and we are at the point of validating the policy. So these are the frameworks that backs up social protection for our state to guarantee sustainability.
Thank you very much. In case you just joined us, this is Hard Talk on Spin 95.3 FM Omaha with the Honorable Commissioner for Poverty Alleviation and Social Protection in Abia State, Mrs. Ngozi Felix. We've been discussing the social protection program, how it's been implemented in Abia State. You can go to our Facebook page, leave your comment, Spin 95.3 FM, or YouTube, alphaspintv, or send your thoughts to our WhatsApp, 0805 5516 953. At this point, I open the phone lines for you to call in to make your comment, ask questions or clarifications on any area that you want that to be done. The phone line is 0805 1777 953, 0805 1777953, or 0916 0009953. Good morning.
Hello?
Yeah, good morning.
Good morning, Mr.
Good morning to you.
Good morning, Mother.
Good morning.
Your analysis is very appetizing, but my concern is that all you are saying has not taken place in my place. Has not taken any effect. I'm from Umurezi. All my education, nothing like cash transfer or registration of the and the poor has taken place in my community. I'm a blind man. Even on my own attempt, I've written to the governor. I have a project which I think can help my community to develop and gain employment to my people. But nothing is happening.
What's your name again?
Hello?
What's your name again?
I'm Chima from Umurezi.
Which local government is that?
Bende.
Bende, LGA. Okay. And the
Yes.
team that are going around to sensitize people who have not visited the area?
Nothing. Even the car transfer, even the registration has not taken place in my. It has not been done in my place, even as I'm speaking.
Okay.
And even the one we did as a disabled, nothing was done to us till now.
Chima, if I may ask you.
That it should not end in the radio.
Okay, listen,
Can
the
you
commissioner wants to ask you a question. Just listen, please.
Chima, if I may ask you,
Okay.
what is the name of your community?
You said
The name of my community is Umurezi.
Umuhu Ezechi.
Umuhu,
Yes, in the local
U-M-U-H-U.
government.
Umuhu Ezechi. Okay.
Umuhu, U-M-U-H-U.
Okay, Ezechi in Bende.
CSI.
In Bende. Okay, thank you very much. I'll take back this information and verify.
I want to ask something. Please.
Okay, go ahead.
I want to ask a suggestion.
Go ahead.
What I'm suggesting is that there's no way Victor can do this job in the locality. Can't you work in synergy with the local people, the community people?
Okay, like the development union or the local government?
I don't need the local government. Even any community that you go,
Town union.
you find out from them who is vulnerable and poor.
All right. Thank you very much. The commissioner has noted, and she promised to take the message back for verification and action. Thank you very much, Chima. Have a nice day ahead. 0916000953 or 08051777953. Good morning.
Hello, good morning.
Good morning to you.
Mr. Chukwuemeka, this is Mr. Andubis. I'm calling from Oboy. Okay, good morning, Honorable Commissioner.
Good morning.
Although your voice is a bit cracky, but let's see if I can manage. Chukwuemeka, it seems these kind of programs are only for the urban areas, because for us down here, I've not been anything like that. I'm Mr. Andubis. I'm calling from Oboy in Ipuano.
Oboy Okike.
Yes.
Okay.
In Ipuano local government. So it's as if all these kind of programs are, being done, or the urban areas are most targeted. Because when I hear Madam made mention of the localities that people are going on, taking registers and all that, like, it's as if this side is not part of Abia, and I wonder the locality he was talking about. Because these whole programs, most times when you hear them like this on radio, you marvel a bit. Is this kind of programs going on? Because they don't reach the local areas. They don't get to the local areas. Like here, there has not been such thing.
Okay.
Has never been done before. So I think they have to expand more.
All right, thank you. Thank you,
Maybe
Mr.
go through the
Udubisi.
Thank you so
Noted.
much.
Thank you. Have a nice day. 0916-0009953 or 0805-1777953. You can go to Facebook Spin 95.3 FM or WhatsApp 0805-5516-953. Good morning.
Good morning.
Good morning to you.
Honorable Commissioner, good morning, ma'am.
Good morning.
Yeah, my name is Michael. My only question, Honorable, please, where is the registration being done? Because I have a mom that is 18 years old and she's blind. And it has been very, very hard to her. Please, I want to know where the registration is being done. Let me bring her there for the registration.
Okay. All right. Your name again?
Yeah?
Your name again. Your name and the